we're going to ultrasound his lungs to look for any interstitial fluid that is held in the lungs by inability of the heart to drain it appropriately. And so that would be the first thing that we do. Technically, ultrasounding his heart, but it matters to our treatment. Seeing on the screen is lung moving back and forth. It's dry to me, so that's good. We'll just check through all the lung fields. First one side and then another. As long as those lungs are sliding back and forth and they look air-filled, then they're in good shape. Start to see the heart here. We'll come back and look at that later. Turn Zeke over. Boy. We look at the lung fields on the left and the right because pathology can exist on one side that's not on the other side, so we want to get a good picture of what's happening on both. This is some of his abdomen coming into the view. So if I were to see wet lung here, instead of horizontal lines going across, which just tells me that sound is appropriately bouncing back and forth between the probe and the surface of the lung, if there were any air trapped in there, sound would be able to penetrate, and so it would actually produce something that we call lung rockets, which looks like something's blasting off from the surface of the lung down below. It looks like a jet stream coming out of a rocket. And that would tell me that the lung had some amount of fluid that was retained in it. So lung should be dry. Zeke's lung is dry, so that's good news. It tells us that his diuretic is working well and that he's not building up extra fluid in the lung spaces. Next, we're going to change ultrasound probes, and so we're going to get the one that will work best for the heart. We will attach some EKG leads on him. This will not be a fully diagnostic EKG, but it will give us a really good idea of how often the heart's beating and whether the electrical signal is traveling correctly through the heart. If a dog were to have an arrhythmia, I would recommend a diagnostic EKG. Zeke is such a good patient. Most dogs do relax pretty well. It is the rare dog that has to have sedation for this. Generally, if they're very afraid, we might need to sedate them just a little bit. We don't want any animal scared, but we do ask them to hold still for kind of a long time. So there are some that aren't used to that, but it's not painful in any way. And as long as the dog's willing to let us rub their belly for a little while in kind of a strange way, then they usually tolerate it really well. For cats, it's a little bit bigger ask because no cat likes to be held down by its legs. Cats think leg warmers are stupid, so they think this heart's horrible. The idea of putting anything wet on a cat and getting them to stand still is amusing, but we do it every day.
Do you typically have to sedate the cats?
Generally not. Although with the fear-free practices of giving gabapentin as a pre-med, that has been very, very useful. And so we will often recommend that a cat get gabapentin the night before and the morning of, just to give them a little bit more peace, because the animal that does not want to be drug out from under the bed, doesn't even want to be seen when company comes over, this is not their idea of that. But generally, they tolerate it better than you think. In 25 years, I think I've had 2 cat patients fall asleep, like not sedated, just thought it was wonderful, and so they passed out for the joy of having a belly rub. But only 2 in 25 years. Okay, so now we're going to look at Zeke's heart. Italian Greyhounds are an athletic breed, so they often will have a little bit of a bigger appearance of their heart for the size that they are. This is contracting nicely, but it's not coming all the way down to a size that I would consider normal for him, even when it's at its full contraction. So that's what his heart medicine will be for. So we will We'll take measurements through the course of the exam and try to have an objective idea of what is happening from one exam to the next. I believe we've ultrasounded Zeke maybe 6 or 7 times. We've been watching him for at least a couple of years, 3 years now. An echocardiogram takes a series of 2-dimensional video clips, and in the sonographer's mind, that has to turn into a 3-dimensional idea of what's happening in the heart. We do that through a series of measurements and over time get an idea of what's changing with the heart. There are 3-dimensional ultrasound capabilities, and that is going to become more important as the technology advances and valve replacement and valve repair become more available. So there will be images that are needed in those situations that a mobile private practitioner like myself will not be able to get. And thankfully, we have cardiologists in town that can take care of that, can take care of getting some of those extra images. And then we have University of Tennessee, we have some other specialists that are available for us to call on if something is beyond a typical picture of heart disease for a dog. Hair is the enemy of ultrasound because it traps air between the probe and the body wall. So we use a lot of gel to be able to obliterate that airspace and give a fluid window into the skin. In Zeke's case, what I'm struggling with a little bit is his conformation. He's got kind of a flatter chest in some places than some dogs will. So, only different speeds, we get variation in color. And so both color flow Doppler and spectral Doppler that gave us that line tracing before are useful to help us know where there are leaks across valves, where there's an increase in velocity and what direction that is, where we have abnormal flow in the heart. And this is really what makes ultrasound the gold standard to evaluate a heart, because you can see things in real time and you can get an accurate picture of where leaks are happening, where blood is flowing appropriately, and where there are abnormal signals. Not every veterinary hospital has ultrasound capabilities. There's a little bit of the art form of ultrasound is that though we are looking for specific things, sometimes a small twist of the probe will give us the image we want or will take us away from the image that we want. So there's kind of a steep learning curve to being confident getting the ultrasound images that you want. Right here is leaking and producing that little flame. It's kind of taking a break for a second, and then the blood's allowed to flow backwards because it's not being actively pressed forward. He's also got a little bit of tricuspid regurgitation, so leakage across that tricuspid valve. I'm seeing that as a little tiny blue flash up there. Blue means that blood is flowing away from the probe face. The probe face is up here in the tricuspid area, and in the mitral area, I would expect for blood to only be flowing roughly toward the probe. There is some flowing away. So I know I've got leakage across 3 out of 4 of his valve leaflets. The 4th valve is here. It's right there. That's the pulmonic valve. And in that case, I would see a red flame shooting up. I don't see that. So it looks like that valve is doing well and performing its function appropriately. Compared to his left atrium, we do a lot of internal standardization. Every animal will have a roughly different, small differences in the size of their heart depending on the size of them. And so if we compare everything to the root of the aorta, we have a choice. We can either compare it all to the root of the aorta or we can compare it to the body weight. And that will give us a good idea of whether that particular structure size is normal for that particular animal. We will measure the velocities across the mitral tricuspid valve. I will go back and compare this exam to previous exams. I will also compare it against the values for his body weight. And that will give us an idea of how abnormal he is and how progressive this is and whether our medication is doing all that we hoped that it would do. Physicists figured out that they could apply the Doppler signal to red blood cells.
Genius.
There's a lot that went into creating this technology. Really, the advancement from the original ultrasound technology to this three-dimensional image that's possible is really very incredible. Okay, so we're seeing those mitral valve leaflets. You can see that they don't quite touch. They should touch and overlap. And that's really the biggest part of the problem for Zeke right now, is that this heart is enlarged and that his valve leaflets can't be fully functional because where they don't touch is where blood can flow backwards. That is what he's struggling with. We are beginning in veterinary medicine to have the capability to do surgery that would bring those closer together. We'll be very glad when we can talk less about treating the heart disease that we have and more about fixing the valves that are really the underlying problem for them. Will be more symmetrically sized. This one's very small right here. This one's quite a lot larger. Typically they're similar in size, so this really points to, this is the left side of the heart here. And it drains blood from the lungs, pushes blood out to the body. This right side of the heart drains blood from the body and pushes it out to the lungs. This is usually the valve that has the most trouble because this side of the heart is the highest pressure system. And so this is a good demonstration of just how different we are from one side to the next. It really does confirm left heart disease for us. I hope for a day where valve repair is more available to our patients. This valve leaked in my heart and I had to get a new valve, and so I'm grateful not to be in heart failure and be able to keep doing this without taking heart medicines. And I look forward to that being available.